I'm back.
All righty. Hey, good afternoon, everybody. Thank you all for joining us again this week. This is Play Therapy in Mental Health Settings Part 2, and Miss Darcy Taggart is with us again this week. I hope you had some time to think about your questions for Darcy. And honestly, I would have sent the transcript from last week, but when I set this meeting up, because I set it up in two parts, they were joined, and it wouldn't let me download the recordings until all of it was finished. And so I'm sorry about that. I didn't realize it was going to do that. Next time I'll set them up separately so it doesn't do that again. But um, without further ado, I am going to let Miss Darcy go ahead and get started.
Oh, so yes, I know you all know who I am. We talked about it last week. If there are specific questions, I pulled some stuff together based on some of the things we talked about last week with some kind of videos for us to watch and some additional information specifically around autism and ASL because we talked about that. But if you have scenarios you want to talk about or questions you want to talk about or specific things that have come up from last week, I would love to know. I'm going to leave a couple minutes right now for people to ask those. You can put them in the chat or you can unmute yourself and talk out loud. I'm perfectly happy either way. Um, if there are, and if not, as we come up, you're welcome to bring those up too as we come up today. But I thought I would give a little bit of space just in case you're like, I had this burning question from last week and had not asked it yet.
Actually, there was a question that came up for me last week.
Perfect.
And I meant to, you might have said this before, but how long have you all been using play therapy in mental health situations like this or in counseling situations? Um,
Oh,
I had
that is a
I just
really
heard of
good question.
I heard of a friend whose child was really benefiting from the use
From
of play
therapy.
therapy in there. Yeah.
Yeah, so I mean, play therapy itself has been around for a really long time. The historical perspective of play therapy really dates all the way back to like Anna Freud, right? Which is like way early in psychotherapy conversations. So, I mean, that's ages and ages and ages ago. Anna Freud, Melanie Klein started talking about the use of play for psychoanalytics and the use of play in therapy with children. I would love to tell you that I know the answer to like when the American Association for Play Therapy or the Association for Play Therapy, which is sort of our national association, was developed. I think at seven counties, different people have utilized play experiences for a really long time. We've just recently, I say just recently, I don't know. I think there's been an association for play therapy in the state of Kentucky for probably at least 40 years on there, but it's been more active within the last probably 15 years or so that we've had an association that has worked with that. There are play therapists across the state. One of the things when I started doing play therapy, because I worked on my play therapy certification for 15 years probably before I actually had it, but then felt really strongly that I was a supervisor so that we could increase the number of supervisors in the state of Kentucky to increase there being access to people who can do play therapy supervision so that there are more trained play therapists. And there are people who have play therapy certifications, like an RPT, which is a registered play therapist. And then there's people who go, I utilize play techniques in therapy because I've been to some trainings or I've done some different things, but I'm not a credentialed play therapist, but that doesn't mean I am not a playful play therapist. So it kind of is the kind of those two different camps. But it's been around for a long time. Like any other specific questions or things that came up? Like that people are saying hello in the chat. That makes me happy.
It looks like our group is a little bigger than it was last week.
Even better.
That's wonderful. That's wonderful.
I was gonna say, it was funny. I actually got off last week and thought, I have no idea how many people were there because I could mostly had made us really small in the corners so that I could look at the PowerPoint. So I don't even know how many people were here last week.
I believe we had 16 or 17 last week. And
Okay.
according to my count, it looks like we have 22 today. So
Yeah, that's what I was thinking. All right. So I love it. Um, well, then as we go through, if there are questions that do come up, especially from newcomers, happy to answer those also. Last week when I was here, I had said that I would bring some videos this week for us to be able, just so you could see maybe some ideas of what a play therapy session might look like. I know some of you have been in play therapy settings or maybe have been in mental health sessions that are play therapy related, and some may not have been. So I was hopeful that this way we could, I could, share a little bit of information just about sort of what that looks like. So I am going to share my screen and share the sound, which I almost didn't do last time and nobody could hear me. And I'm going to start my slideshow from the beginning. We're going to talk a little bit about part two. So yeah, so a couple of things, just this was kind of just a slide to review a little bit of what we talked about last week, that the role of play in therapy is really that play is a child's kind of universal language. It's a natural language for children. It allows expression beyond words, which in that respect, I think makes it a really good modality to use across a language barrier. And also it's crucial when kids have nonverbal or when verbal communication is failing. So that's another reason why it might be something we utilize across language barriers for kids, because kids, it's their natural language for kids, and we want to make sure that we're observing play. Therapists are gaining insight by watching how kids play, what kind of toys they play with, what things they're doing, all of that kind of stuff. So, all right, hold on. Is my PowerPoint coming across or is it doing something weird now? Now I feel like it's doing something weird.
we saw it a second ago, and now it's just kind of a blank screen.
It did something funny. Hold
I'm
on.
so sorry. I did
No,
give you
you're
host
fine.
capabilities, so
I think I just, yeah, I think, hold on, I'm going to pause it, stop it. I want to share something a different way because I want to be able to see you all also. And I think that is what I'm doing wrong. Okay. All right. Now, can you?
yay. That looks right.
Good. All right. So, now I got it. So this is last week we talked about the two different kind of camps of play therapy, that we have child-directed play and we have directive play. So I pulled this video of Gary Landreth is the therapist there. He's actually kind of the founder of what we call child-centered play therapy, CCPT. And this is just a short video of him doing child-centered play. I attempted to find some videos of play therapy where the therapist was playing and there was a kid and there was an interpreter, but that I was not super successful about. So instead, I pulled an example of child directed, an example of more therapist directed, and thought we'd kind of just look at those together and let you ask questions or just kind of view it if there's anything that comes up from that. So I will start Gary Landreth and we will go from there.
Oh, you're just going to put that right up? Oh, you know how that goes. Mm-hmm.
Yeah. I have to get ready.
You have to get ready now. We have 5 more minutes in the playroom, and then it will be time to go down to the waiting room where your mom is.
Okay. Take the blood.
And you're going to take my blood with that? Oh. So you know how to use this.
Can I get one at home?
Oh, you have one at home, so you know how to use it. Mm-hmm.
Yep.
Mm-hmm. And you got that.
Well, I'm sorry.
Whoops. And that goes, like that. Oh. And you're going to put that right there and check on me. And you're making that go around. You just checked me.
Yeah, maybe you need to check me now.
Oh, so you think maybe you need to be checked too.
Yeah, put this mask on.
So I need to put the mask on.
And put those over your neck.
And I put this.
Over your neck.
You show me how you want me to put it.
Here, let me do.
So you're going to put that on me like that.
Okay. And I'm mask.
And you're going to put the mask on me. Like there, you put the mask on me now. Now I have the mask on.
Take that off.
I have this on my neck.
Okay, and put this
And we're going to put this on you right here. And
put that through here. And put that on your ears.
And I put, okay, now I put, so now I put this right there.
There
Okay,
it is.
now I got that.
Put it through here.
And then I put this right
There.
there.
And then squeeze that.
And then I squeeze this. I can hear it going around. Makes a noise.
Now I'm going to doctor you, but I'm not going to do your blood pressure.
Now you're going to doctor me but not do my blood pressure.
Let's do this one.
There's that.
Thanks.
So you need this.
Can't talk when you have that on.
Oh, not supposed to talk.
Why do you have pain on that?
There is some paint on that.
Why is it?
I don't know how the paint got on there. Just got on there. And you notice there's paint on there.
Some people wear it like that.
Some people wear it like that, you think.
So why does this one like that?
Looks like it can go any way you want it to go. So it can be like that.
Okay.
Yeah. So now you've got it on,
I'm all ready to fix.
and you're all ready to fix something.
Okay.
Now that's in your ears. And you're, whoops, kind of hard to hold on to that. And you're checking me. I can feel you checking me right there. You're holding it very still.
It was beeping.
It was beeping. So you're just through with that.
Remember that.
And Kate, our time is up for today in the playroom. It's time to go down to the waiting room where your mom
Can I
is.
try this real quick?
And you're going to try that.
All right. What did we notice? We talked about some of those facilitated responses last week that people sometimes do. Anybody see any of those? Like noticing or repeating? Anybody have thoughts about watching that?
That kid was very into her she had an assignment and she was trying to finish it.
Yes, that happens a lot in play
Does
therapy
it?
that we
Okay.
have kids that also that you say, okay, it's time for a session to be done, and they go, oh, but I need to. Oh, but yeah. I was just talking about somebody about that. Yes, she's very persistent with the stethoscope. Agreed, Sylvia. I was noticing all of his, and this is almost stopped it to say, so this is something that happens in play therapy a lot is I know what the thing is, but I'm giving, especially in child-directed play therapy, I'm giving that child permission to do what they need to do. So I might say, and how do I use it, right? Even if I know how to use a stethoscope, I know how to use a blood pressure cuff, but instead of me saying, oh, I'm supposed to do this. Yeah, well, I couldn't say if it was,
Dean, if you're trying to make a comment, we're having a little trouble hearing you.
I couldn't decide if we were trying to make a comment or if it had just gotten unmuted. That happens too. Um, but yes, kids a lot of times like I'll know how to use it, but instead, especially if I'm doing child-directed play, and so you might see therapists do this, is to say, how should I use it? Or, oh, you're handing me that. What do I do with it? Because I'm giving that power and control back to the kid to be able to tell me what that is. I noticed at the first she started to put the blood pressure cuff on and she said, I'm going to take your blood. And he just repeated, you're going to take my blood. Oh, you're totally fine. Yeah, letting the child have the initiative, especially in child-directed play, which a lot of our staff will utilize, especially with younger kids, child-directed play. I think last week we talked a little bit about kids on the spectrum. That tends to lend itself really well to child-directed play because I'm going to follow your lead. I'm going to follow your interest. And I can use any of those things like noticing what you're doing and saying, I'm noticing that you are really drawn to this toy, or you really know how to do that. Repeating statements so kids know that we're really listening to what they're saying. So he did that a couple of times with sort of saying, oh, okay, I put it in my ears like this. So I'm acknowledging that you're telling me how to do something with that. There are limits in play therapy. This is not a clip that shows where he had to set a limit because she wasn't doing anything necessarily problematic that we might need to set a limit on. Although, if she continues to play, we don't watch like the very end of it, but if she continues to say, like, oh, but I need to do this one, oh, but I need to do this one, and it really is time to go, the therapist might say, oh, I can tell that you're really hoping to be able to play with whatever this thing is. We can play with that next time. But today our time is done, and continuing to set that limit for being able to move out of the play therapy space. Any other thoughts on our child-directed clip? Oh, that's really good. Rate of success. Okay, so, and I actually do have a clip in a little bit of a thing about working specifically with kids on the autism spectrum. I feel like I have a huge amount of success with that. I don't know if I have a rate of percentage, but it definitely kids on the spectrum, and I have not worked specifically with kids who need ASL interpreting. So I can't give a specific statistic on hearing impaired children, but because specifically child-directed play really lends itself to being able to play without language or without words, right? I might just be able to do stuff with gestures or with kind of like a specific pause put into there. Both kids on the autism spectrum who maybe have limited or minimal verbal skills, and also kids with ASL. Now, with ASL, I'm going to want to be adding in some, and I have a clip about some of that too, some really basic signs around doing that as well, because my goal, both for really for any kid that is minimally verbal or less verbal, is to increase effective communication. When I'm trying to increase effective communication, that doesn't always mean verbal communication. Sometimes that is gestures, hand signals, signs, use of picture or visuals in order to be able to increase their communication strategies. It's also something I work with parents of those kids around, which is not to miss attempts at verbalization, because sometimes we, in our effort to only, or attempts at communication, in our effort to really, we are a society that values verbal communication. And so sometimes as I'm valuing that verbal communication, I am not paying enough attention to the ways that that child is communicating. And so part of my job as a play therapist is to observe how that child is communicating. What are the ways in which they communicate, even if it's not verbally? And then to work on increasing and expanding that capacity for communication. So whether I'm using signs to do that, whether I'm using gestures, or following points or following engagement. And if, for example, I was in a session the other day, kid kept pointing to something, and I could tell, and I know like a minute amount of Spanish, but I could tell that what the kid was saying was that, right? Or there, right? Like that thing was pointing to the thing. And we weren't sure what it was. It was something up on top of the shelf. And so would point to it and be like this, and then once we figured out what it was, naming that for that kid. I would do the same thing with a kid on the spectrum. That if a kid is pointing, I might point and, wait for the kid to like nod, yes, yes, that, and go, okay, you want chair. If I know that the kid knows some verbal language, I might say chair, or chair please, or whatever, because I'm trying to increase that communication. But I don't want to only accept verbal communication if they don't have verbal communication, or if we don't speak the same language. So we might want to work on that. That can be another reason why, at least with kids where it's a language difference between the therapist and the child, having an interpreter can be helpful, because they might be asking for it, and I might not just not understand the word or know the word for that. Same thing with ASL, that having somebody that's in there helping to identify that. With younger kids, oftentimes they don't necessarily have, they may not have the sign language to do that, but that might be something that they're using. I also think it's helpful for the therapist to ask, and usually I will direct our staff to do that. How does this child most frequently communicate? Do they have an assistive communication device? Do they have a laptop or an iPad or something that they use? And can you show me how to use it, so that I make sure that I'm utilizing the same thing that the parents are utilizing and the school is utilizing and other people are, because that's going to be more effective in increasing that communication. So while I don't know that I can say, oh, there's 80% success or 100% success, I think we do know that there is a high rate of success with utilizing play therapy with kids on the spectrum and ASL. And I actually think that play therapy, I might be a little biased because I am a play therapist, but to me, the statistics on play therapy in general, as far as a successful modality, are really high, because we know that as far as brain development goes, it takes approximately 400 repetitions for individuals to learn a new skill by doing that, or to learn a new thing, but it only takes between 20 and 40 repetitions if we do that same skill through play. So if I'm adding playful based information to it, or playful based interventions, then I'm more successful at hitting that rate. I would say, oh, in pair play, that's a good question too. I feel like that can be really hugely successful. It's hard for us to find ways to do that in an outpatient play therapy setting unless we're doing groups. But I do think that pairing okay, it depends on the neurotypical child and their ability to sort of engage in that setting. But my general experience is that if I add an extra kid in, that can be really helpful in increasing the rate of success, because now I have another kid who's also doing those socialization skills. But sometimes what I find is it's more helpful. It doesn't, like, I can do a play group with 3 kids on the autism spectrum and probably be just as successful as I would be if I added a kid that's neurotypical into that play group. I don't necessarily know that it depends um, on the typical versus neurotypical kids, but I think that having those play-based interactions between peers can be really helpful once we have socialization engagement with kids on the spectrum with the adult, right? So I want to make sure, if I'm the therapist for that child, that they have some joint attention skills themselves for me. First, like, I want to make sure that they have joint attention with the therapist and that they have some back and forth engagement. And then I can add a third person in there to work on socialization with a same age peer, or can do stuff in classroom settings. Um, any of those kinds of things. All right. Jane asked, are there specific play-based activities or therapeutic techniques where the presence of an interpreter may influence a child's behavior or engagement? So, again, I'm not 100% sure of all of the research behind that. My experience has been that sometimes, especially, and this is something that a lot of our therapists are working on. In fact, I think there was recently a situation where we, and no offense to the interpreter in any capacity, but we kind of started being like, how about we have the interpreter and the mom not be in session? Not because we didn't feel like it was helpful for the parent, but because there was so much verbalization going on with the parent and the interpreter and the therapist that I felt like the kid was getting lost. And that because the kid, who was perfectly happy to play by themselves without engaging, was not getting the engagement that they needed. And so when we pulled out all of that language stuff and did more child-directed play, where we were using very limited, like, single words or gestures or simple phrases, things like that, the therapist actually started getting better, increased joint attention and engagement with the kid. So there are times when it might start to feel like there's too much going on in that verbal capacity, especially with kids that have minimal verbal skills. And we need to start more with doing just child-directed play where I'm utilizing gestures and basic communication, and then we could add that in. All of that said, I usually say, let's pull the parent in then at the end, and or do collateral sessions, parent, interpreter, therapist, so that the therapist can talk to the parent about what they're doing in play therapy sessions. Because I never want, I think this happens too often with our non-English speaking families or non-native English speaking families, that the parent gets, I never want the parent to feel kicked out of the therapeutic process. But that doesn't always mean that it's helpful to do that in the session with the kids. Sometimes it's helpful to do that in a two-part capacity, where I'm meeting with the kid at first, and then I'm also meeting with the parent to talk about what we're doing in session, what kinds of things are happening, what things they could do at home. And that adult conversation can be really helpful in having some of that interpretation. Because it's just hard, right? It can interfere with that. Yeah, exactly, Jane. The flow of that activity, or it just gets overwhelming to do that. And, but I always think we want to pull them in with adult caregivers. I get very frustrated. I know I work at 7 counties, and so I get very frustrated with the ways that many of our non-native English speaking families come in and have been, like, completely kicked out of the school process. And I get very frustrated with that. I'm like, okay, we need, right? Like, if something's going on at the school, I want the parent to know what's going on at the school. And even though that might take us a little bit of extra things to get to with the language barrier, there's importance in that too, because they can't partner with the school and they can't partner with the therapist if we don't have, if they don't have that information. So,
I just thought of
yeah.
a question. When you mentioned having multiple children work in a therapy session together, what does that look like from a HIPAA perspective?
Yeah, so I mean, they'd have to sign up for a group. So they have to know that they're in a group, right? So, like, that I mean, obviously parent is agreeing to bring kid to group. And so the recognition that in group therapy there is we still review the rules of that with confidentiality, with things like that. Especially with older kids, we always kind of like what happens here stays here. And I think we would do that with any group, but my younger kids may or may not completely, totally understand what I'm saying by confidentiality. But the recognition that I cannot, adding additional people into a group process changes that a little bit.
Hmm.
Because while I am not going to, I'm still as your therapist, not going to share that outside of that. I can't promise that's not going to happen outside of that, but we do try to address that as part of the group scenario to just say, hey, there's confidentiality. Something else too, in my private practice, I have some kids, we live in or we have a practice building in a walkable neighborhood. And so one of the parts of our consent in this practice is that we do some nature-based play activities where we are out in the neighborhood, walking, practicing limits, practicing. I've got one kid that like works on practicing asking questions and waiting for a response by seeing how many dogs we can find to pet in the neighborhood and how many people we can ask, right? And waiting for that, like there is some, and actually that's a kid on the spectrum. There is some of that socialization piece around that. Well, we need to practice that. But inherent in doing that is the fact that like if they see this kid out in the neighborhood with me and they happen to know who we are in this little walk, in this little block, they know this kid's in therapy, right? And so same thing with the backyard, that if we're doing stuff in the backyard of our practice, even though it's fenced, our neighbors know what we do. So usually I just make sure that the parent has signed a consent with that. There is a policy on, like, the Association for Play Therapy has a policy on touch in play therapy, that if like that there are ways that we might utilize therapeutic touch, not on holding kids by any means, but on, like, if a kid asks for a hug, I might give a hug. If it feels like a kid needs a big giant squeeze for their sensory stimulation, I might do that. And I usually will have parents sign that consent as well, just so that they know that these are inherent things that might break your confidentiality a little bit, which breaks HIPAA. Not
Right,
intentionally, but yeah.
right. And interpreters are required to abide by
Yes.
HIPAA standards. And so I
Yeah.
just wanted to, also, I attended a webinar yesterday on HIPAA, so it's kind of fresh in my mind.
Fresh in your mind. Yes. One of the things I actually was thinking about when I was doing this, and there's a slide, but I don't need to pull up this slide to talk about this, is that some of the hazards for you all as interpreters into sessions, like, I think therapists, we have a ton of training on secondary trauma and on what it feels like to hold all of that for a family and for a child. But you all also hold that as interpreters, because when you come into our sessions, if I have a kid telling part of their trauma narrative or part of their trauma story, you guys are hearing that too. And so, what I always say with our therapists is making sure that they have their own really good, like, self-care space or group of people to talk to about that, or ways to sort of be able to help reduce the effects of secondary trauma. That might be another area for additional training or additional supports, because I think you all hold those hard stories just the same way that we do. Because just because I'm the therapist and you're the interpreter doesn't necessarily mean we both aren't hearing that same traumatic story and needing to be able to recognize that that impacts us, right? Perfect. You really try, because I do think that that is, I think, self-care for any adult that holds hard stories. And you may, also, because you also know, like, individuals, you might know individuals in multiple capacities in the community with that. And I think that also brings in an element of just additional stuff to looking at what those kinds of things that you guys are holding for clients when you come to sessions. I think the other thing that I had kind of brought up was sort of those psychological terms, that, like, one of the things that I remember us having a conversation about at one point was just like that sometimes a specific term that a therapist uses either doesn't have a really exact translation, or is, we don't like, it's too broad, right? It's like, and so in order to be able to understand how to interpret that, you guys need to know, what does that term mean? So I would hope that if you asked a therapist, hey, what is that? Can you give me a little bit more information about this thing that you just said? and that the therapist can both define it and give that. If not, it's acceptable to say, hey, I need a little more information. Can we look up a definition? Can we do something? Because ultimately, I can't interpret it if you don't know the definition as the therapist. If you're just utilizing it or you can't explain it, then I might need to be able to explain it. And I want to make sure, yeah, acronyms, right? Absolutely, Jane. We use acronyms so much. Half the time, actually, like I used to say that I felt like we needed a document when therapists first came to work at 7 counties that like spelled out what we're talking about. But yeah, absolutely. Always say, hey, I didn't get that one, or can you do that? Jane, did you want to say something? You're welcome to unmute yourself and say it.
I do have a
You also
question
might
for
have
you.
just raised your hand, but
No, I do
oh,
have a
here.
question. It's just a little bit long because I would love to add some context to it
Sure.
to hopefully facilitate the answer. Um, are there specific boundaries or guidelines you would like us interpreters to follow when interacting with a child during a therapy session, and specifically during activities that involve physical objects or toys? And this
Mhm.
is the part where I would love to add some context to it.
Oh, sure. Go for
Sometimes
it.
we are there, and for the kiddos we are just another playmate, right? So they interact with us, they play with us, and more than once I have felt that I'm overstepping or doing something that I'm not allowed to do.
Mhm.
And I would love a little bit of a clarification on that. So if the child interact with me, or if he wants to play pretend with me during a therapy session, or he feels familiar with me because I'm from his same country.
Yes.
What do we do? What can we do to not overstep and to not feel or to not, yeah, feel that we are somehow interrupting or doing something that we are not supposed to?
Yeah, that's a really good question, Jane. Because I think that happens a lot, right? Like kids have very little distinction between the adult that is the therapist, the adult that is the interpreter. You're all just adults and you're all playing with me, right? You're all here in session. And so they'll bring you stuff. I actually, I, while I don't necessarily interpret, I come in as a supervisor to observe a lot of sessions. And I feel like this happens all the time, that I just get pulled right into the play scenario. With some of that. Sometimes I will direct them back to the therapist, but most of the time, I would just ask the therapist, what would you like me to do in this scenario? And I'm hoping that I can have these exact same conversations with my staff, at least around this, that the therapist might say, you can say this, right? Or like, because in some respects, they're inviting you into their play, and that is part of what that is. I don't think children completely understand like adults do. So if you're in there, like best practices for interpretation with a parent and a therapist and an interpreter is that we sit in a triangle, and that, therapist is, you guys know these things, right? Therapist is talking to the client or the parent, and you're interpreting. That I wouldn't necessarily look at you and talk to you, that my job is to look at the client and talk to the client, but also to like wait when it's time to let you interpret, because if I just keep talking, then you can't do that. But with kids, I don't think kids get that same concept, right? They don't know the difference between me and you when we're all in session together. You're another playmate. And so I don't feel like it's overstepping necessarily, as long as we keep kind of checking in. Hey, is this okay? Right? Um, and playing in that scenario, I would want to include that. Now, I also am okay if an interpreter does not feel super comfortable being included in the play scenario. But in my experience, if you're in my office, you're just going to get added to the bunch of adults that are around there. And I have encouraged our therapists, and I'm hopeful that as we continue to kind of do that, that also if there's a time when you're like, hey, something comes up in a session like that, Jane, that like afterwards you might be able to I think this is totally fine, by the way, and therapists would be okay with this to say, hey, I have a question for you, but like I don't have time right now because I got to go to my next appointment. Can I shoot you an email and ask you that question? Especially if I'm going to come back and end up interpreting with this family again. And then you just say, hey, in that scenario, like I didn't want to overstep. I want to make sure that what I'm doing is okay. How can we make sure that we do that? I think that's all right. I think it's actually one of the reasons why it would be really great for us as therapists to start building some relationships. And actually, kind of how this training came about is that in talking with my own staff, they went, we don't know, like we don't know. Are we, would it be more helpful to have the same interpreter every time with a family? Ideally, sure, that'd be great, especially if it's somebody the family knows, because then they don't feel like they're telling their story to every single person all over the place. It's the same person that's hearing pieces of that. You guys don't always have, I realize, the time and energy to do that because it's not your job to show up just every, Tuesday at 3 with whoever it is that we have. But ideally, I want you all to feel like you can partner with our therapist by asking those questions if it feels like it's appropriate and not feeling like you just have to go, I'm going to take a back seat. Because you are in play therapy, especially in play therapy sessions. Maybe not in every session, but in play therapy sessions, I think adding you in makes a lot of sense.
Thank you for that. And honestly, I have had a great experience with all the therapists there. But as you just mentioned, sometimes we or the therapists don't have the time to kind of go over a few things after the
Yes.
appointment. So we kind of, in a hurry pretty much all the time. But that is
Uh-huh.
a good suggestion. And thank you so much. And thank you for clarifying all my questions today.
Yeah, absolutely. Thanks for having questions. I love it.
I actually have a follow-up one.
Sure.
I'm sorry. It's about side conversations because, as you mentioned earlier, sometimes there are a lot of adults in the therapy session, sometimes even mom and dad. And
Hmm.
while the attention is focused on the child, um, sometimes mom and dad are making side comments or somehow discipline the child because they think
Yes.
that maybe what the child is doing is incorrect, right? Because I don't know, they may be shy or something,
Hmm. Hmm.
and the kid is just playing. So, would you, as a therapist, will rather us to interpret the whole thing or more being focusing on what's going on between you and the kid? Um, because again, for us also, all those things that are going on and all those side conversations for interpreters can be a little bit overwhelmed as well.
Hmm.
Because at some point we get lost and we don't know what to interpret. So
Yes.
what on your personal experience, what would you like us to do?
It's a good question. In my personal experience, I think I would like to stay focused on interpreting what's going on with the kid. But a secondary piece of that is I try to regularly say um, to parents, whether they speak the same language I do or not, like what happens in the playroom sometimes is different than what's acceptable at home. So if a parent is having a side conversation that involves, especially that involves like what I'm doing as a therapist, or that I'm not setting a limit that they feel like they should set, like I think that is a twofold. One, I don't want to completely let a kid do something that the parent would never let them do without saying something to the kid about that, right? So, like, there might be things that I would let a kid do in my office that a parent would not be comfortable with at home, but I want to make sure that I make a statement that says, remember, sometimes you can do things here in the playroom that you can't do in other places like home or school. So that the kid is hearing me set that limit around the acceptability here in this session, but possibly not the acceptability at home, right? I also want parents to feel like if it's bothering me, I will set a limit. Um, but but I don't want them to feel like they can't let me know that it's something that they would never let the kid do. So I think that's twofold. If you are hearing, because, and actually, I'm gonna put that in there, like the whole conversation is part of accuracy. And I think that is true. Like it's helpful for me to know what they're talking about, unless they've completely devolved into something like what their grocery list is for today, right? I don't need to know that necessarily, but I will say that I don't always know that that's what it is. And so sometimes it can be helpful, right? To redirect and go, hey, we're all going to focus back on that. I would want the therapist to do that. I would want to do that. Um, but also, it can be helpful for us partnering with you all, for you all, if there's something that the parents are talking about, to make sure that we know that too. Because sometimes just because they're talking doesn't mean that it's a direct question to us, but it's still important information for me to know what it is they're talking about, especially when it involves what's going on in the session. And I would hope, what I don't want to see happen is therapist and kid break off and they're just kind of doing their own thing, right? And parents are over here having a side conversation and you feel torn between, am I supposed to be interpreting what the parents are talking about or what's going on in the session, or right? That if that starts to devolve, especially if that happens over and over with the same with the same family in sessions, that we figure out together, okay, how are we gonna figure that out for this family? How, like, what's that side conversation? Because I think that's when, especially with our older kids, sometimes kids will, we've had kids tell the therapist, like, it's not interpreting everything that's going on. And then I'm like, I don't know if that's because what was going on with the parents doesn't feel important. So it doesn't feel like it's something we need to bring into session. Or if it's like there's just too much going on. And so we're missing parts of the conversation because there's too much going on. So I think being able to set a limit to say, hey, we're going to keep this up. And I would hope that that therapist would do that, because I don't want you all to have to necessarily do it. Although if you feel like there's too much going on for you to be able to interpret, I absolutely would want you to set a limit and just say, hey, this feels like there's a lot of conversation and I'm having a hard time figuring out where to put my focus. And then that way the therapist knows, okay, I need to set a limit on what's going on and the side conversations with some of that. And yes, culture definitely comes into play with that, Lisa. Like I think here's the other thing, and this is something I remind my therapist. This isn't necessarily something I'm telling you. I have a recognition that if you come into a session and you and the client speak the same language and I do not, and especially if you have been interpreting in several of their mental health sessions, you are going to want to catch up with that person just the way that I would start to catch up with that person. And like, it's okay for the therapist to say, hey, what's going on? If you two are having a conversation, and it's okay for you to say, we're just catching up, right? Just the same way I would catch up with somebody. The first 5 minutes of any session is, how you doing? What's been going on, right? And you guys might be having those conversations, and you might not need to interpret every single thing in that conversation because you're saying hello and getting caught up with each other the same way that I would get caught up with them. As long as it doesn't devolve into doing that for 30 minutes, I think we're good. Because I don't want to put you guys in the situation of having to be the therapist. But you are going to know things about families that we don't know, and that's okay. Or you're going to know people and want to say hello, and that's okay too. Questions are so good. I love it. Does anyone else have a question? I might do, because I realize that our time is starting to run a little short, and I want to make sure that we give plenty of time for that. I'm going to show you really quick some of the other, just the begin, like not the videos, but I'm going to show you what videos they are, and then I'm going to send the links to an email. And that way you guys can watch them on your own, because I think that they can be really helpful, but I want you all to feel like you're getting your questions answered and that you still have access to that information to do that. So let me show you a couple other things just so you know what you're going. So there was that one, which was child directed, which we don't want to do again. And this one is one on a directive intervention, one called How About You, which I am gonna share and show. There's gonna be one on, oh, hold on. I'm gonna play through it so that I can switch to the next thing in the PowerPoint. Actually, you know what? I'm gonna stop the PowerPoint and just show you on that. All right, so you'll have that one. You'll have one on another directive intervention, which was like a Feelings Candyland game that I thought might be helpful to watch. I have a video on autism and some of the best practices for communication games with autism because some folks had asked last time. And then a couple things on like basic beginning signs with ASL. One of the things that they talked about with ASL and play therapy is integrating simple signs, more help, all done into basic play routines and using visual aids and repetitions. So that would definitely be part of that kind of best practices with that. And then I'm going to share a video after the fact on kind of some key takeaways. So I'll send all of those afterwards to you all. Looking down at your questions. Yep, I'll send them to you, Lisa. Any other questions that have come up? Ultimately, I think that the kind of key takeaway from play therapy that I want you to get is that like the goal of all of play therapy is to facilitate kids' self-expression through play. And we realize that you all serving as a bridge for that verbal support, even if you don't have to be the primary communicator, and us being able to respect cultural differences and build a strong, trusting bond with you all is going to make those situations and those playful experiences even better for our kids.
This has been really awesome, Darcy. Thank you.
Absolutely. Happy to
Um,
do it.
I will follow up with everybody. We'll receive a copy of your certificate for attending the session today. And if you want a copy of the this specific video, we can send it. But what we plan to do is post this on our YouTube page, where the rest of our video training resources are. And so
Fantastic.
what I'll likely do is send everybody a link to that so that all of it will be in the same place.
Perfect.
Okay.
Thank you all for coming and for wanting to be here, wanting to learn more about play therapy. I'm always around too. I'll send my email along with those things. So if you have questions, specific thing that come up, you're always welcome to shoot me an email and say, hey, I have a question about this. So
Thank you so much, Darcy.
you're so welcome. Lovely to see you all on a rainy Wednesday afternoon. Stay safe and warm and hopefully dry.
Yeah, you too. And Merry Christmas. Happy New Year, everybody.
Merry
If we don't
Christmas,
talk
Happy New
again,
Year, happy
yeah.
all the holidays, all the things. That's right. All the things that are coming up.
All right.
Good to
Well,
see you
everyone
all.
take care. Thank you all so much.
Thank you.